33rd day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to the session, and today our guest is Dr. LUBNA KAMAL from Lucknow. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, we have 3 sessions in a row. That is 7 to 8, we have our Hindi session, 8 to 9, our international session in English, and 9 to 10, we have our local language session in Malayalam. Today, our guest is Dr. LUBNA KAMAL, MD. She has completed MD and then she went to MBA and completed PhD and is working as an associate professor, Department of Material Medica, State Jawaharlal Nehru Homeopathic Medical College, Lucknow, Uttar Pradesh. Dr. LUBNA KAMAL is a homeopathic nephrologist. Is one of the very few in the world with experience of spanning over 2 decades, and she, along with her team, have treated over 21,000 patients suffering from renal failure from all over India and abroad, for which she has been awarded the Influential Book of World Records. Her research purpose in the International Conference of Liga in 2011 was the only one from around the world on treatment of renal failure and homeopathy. As an associate professor in State JLN Homeopathic Medical College and through her NGO, she is working to create awareness about renal failure and conducting free screening. During COVID, she mentioned her UG students. She monitored the UG students to help a lot of patients with homeopathy, for which she was awarded the World Book of Records in London. And the 2000, in the 21st century homeopath, the 21st century homeopath has contributed hundreds of articles in national, international peer-reviewed journals regularly. And she appears in talk shows and interviews at various TV and media. She is a qualified pranic healer, a dream analyst, a medical astrologer, relationship coach, TV debater, journalist, editor, author, writer, gender activist, peace activist, public speaker, socialist. So many such things are in her kitty, and she utilizes her skills and heal. She used her skills to heal her patients holistically. Today, she will be talking about an important subject, the importance of hope, that is the World Health Organization Quality of Life Questionnaire in homeopathy. So this is a big subject, and we want to hear more about that from Dr. LUBNA KAMAL, and we proudly welcome you to this stage. We can have the presentation for the next 45 minutes, and then we will have a discussion.
Thank you very much for having me here. Good evening, salam and namaste, and good morning to rest of the world. Before starting with this topic, WHOQOL, which is World Health Organization Quality of Life Questionnaire, I would want, if any one of you would like to answer, how are you today? Any one of you would like to answer that?
Yes, we have locked all these persons because there was a disturbance last time. So nobody is allowed to speak. Only those people can chat, have a chat with you only.
All right, then I'll proceed.
Okay.
Just a minute. So this is about quality of life assessment. But what is quality of life? So quality of life refers to an individual's subjective perception of their overall well-being. How am I feeling today? How am I feeling? How have I been feeling from last 1 month, from last 1 year. That is my perception. How do I feel about myself and my well-being? So now this well-being, because WHO has came up with this definition of health, which includes physical, psychological, social, every aspect of health, not just physical. So what are the parameters of good life? How can you say that you are leading a good life? How can you say that you are satisfied with your life? The most important thing, I mean, this may sound a little boring, but all this is very, very important. So please pay attention. The most important thing is health and well-being. So health, being healthy, being wise, that is the probably the most important thing for each of us, and that is what doctors take care of. If one is not healthy and has lot of money, it is hardly of any use. The second important thing is meaning and personal growth and development. Now, what is personal growth? How can you say that you are developing or you are having this personal growth? So continual personal growth and learning and self-improvement are parameters of good life. The third important thing is emotional well-being. No matter how successful you are, no matter how much, how physically healthy you are, your blood test might be normal, your scans might be normal, but you might be emotionally unfit and emotionally unwell. So the emotional well-being, the mental well-being, all those now count in the definition of health. And without emotional well-being, you cannot have a good life. The next important thing is positive relationships, and this is perhaps the most, one of the most important things. Why? Because when I scan the patient, when I am in the process of taking their case, there are so many
Doctor, slides are not moving.
the slides are not moving.
No, it's not moving still. Still in the first
Now
page.
are they moving?
The first page itself.
No, I mean
You please put on slideshow.
that I have done already.
Otherwise, you just click on the computer.
Hmm. How am I supposed to do that? Okay, I'm resharing it.
Yes, yes. You start resharing.
Now please tell me if please inform if this is visible.
Yes, yes. Importance of the homeopathy.
It's visible now?
Yes, yes, yes. It is moving. Yes, now it is moving.
So this was the second slide. This is about health. That is the most important thing. The personal growth, emotional well-being, and positive relationships. So I was talking about this, and what I've found in so many of my patients, that relationships have affected them negatively, and patients have landed in cancer, in renal failure, and in so many different diseases, just because the relationships around the person was not a very healthy one, or was not a positive one. Without financial security, which is the next point, we cannot imagine being well, because money is needed for everything. It is important. It is not the most important thing, but yes, it is important to meet out the basic needs, to buy medicines, to buy food, to buy the basic necessities of life. So financial security is as important than the work-life balance. If a person is earning a lot and they are not maintaining a healthy balance in their work and in their leisure time, in their relaxation time, then they are not healthy and they cannot be called as having a quality of life. Then connection with nature, it's very important that we are aware of our environment. If we are living in an unhealthy environment, we cannot be healthy. Why? I'll tell you a very practical example. I've told this in a number of webinars. We had a clinic in Patna before COVID, and we have a clinic in Delhi. So there is great deal of difference between the kind of patients we get in Delhi and the kind of patients we get in Patna. The Bihar patients, they are very easy to treat and they respond so well to homeopathic medicines. I mean, this has happened so many times that they respond very well. The people, the patients coming from, the rural background, coming from far off villages, they respond to medicines much better. Why? Because the environmental factors are much better over there. The AQI of Delhi is never touches 300. It's always above 300, 400, and 500. So you have to maintain a healthy environment, the physical environment around you, in order to have proper health and altruism and contribution. If we are happy, if we are very healthy, if we are leading a good life, but we are not helping others to be happy, if suppose my neighbor is not happy, if they are ill, and if we are not bothered by it, that means we are not actually healthy. We are not, unless and until we are helping them to lead a better life, we cannot call ourselves to be healthy and to be maintaining quality of life. Now, why this topic? Why? What was the need of this topic in homeopathy? Why are we discussing this in homeopathy? Why? The most important thing, now this is the slide which is the most important for us. We are dealing with the first point. We are dealing with the chronic diseases. The most of the homeopathic doctors, we deal each day with chronic diseases, all sorts of chronic diseases. Now, quality of life in patients with chronic diseases. When a patient comes to us after being drugged, after running to a lot of hospitals, after being treated by modern medicine practitioners, the most important thing which I have found in my practice is that they are just so depressed. Even if they are suffering from arthritis, I deal with chronic renal failure cases, liver cirrhosis, cancers. All those patients are so depressed. Even if their condition is regressing, even if the cancer is supposed regressing, then too they are so depressed. Why? Because of the side effects of so many medicines. The quality of life is not maintained, and that is why WHO coined this questionnaire. This was needed because a patient might be better symptomatically or reports wise, but it's the quality of life which will ultimately decide that a patient is really improving when they start enjoying things around them, when they start enjoying life. So this is where homeopathy works best. You might not be able to cure renal failure, but definitely you can improve the quality of life of a renal failure patient. This is probably the most important thing, and I feel that all the homeopathic doctors over here will agree to this, that we are improving the quality of life of patient, even if they are on deathbed, even if they are on terminal illnesses like cancers. Still, the quality of life of the patient improves with homeopathy. And that is why it is a great need for each and every homeopathic doctor to understand this and to use it. We will further discuss it, how to use, when to use, why to use. But first of all, we must understand its importance. Then the second thing is quality of life in cancer survivors. Now, this is something we have already discussed. There are cancer patients who cannot go for surgery, who cannot go for radio or chemotherapy. Now, what to do? They try to take or they try to switch to alternative treatments. And here is where homeopathy comes into play. How? Because we have such wonderful medicines, which, you give a single dose and the patient starts telling you, I'm feeling mentally better. Why? I'll just state a case. I was student of homeopathy of second year, and a cousin of mine had come to stay with me at our house for some kind of examination. She had to appear for some kind of examination, and she came, and the next day she was ill and she had to give that examination, and paracetamol was not working on her. She had high fever and she had very severe body ache. So there was absolutely no time for this detailed case taking, or so on the basis of acute symptoms. And I had known that her mother had arthritis, so I gave her eupatorium perf, and I think I gave her in 200. And the moment I had given her, after 15 minutes, I might have asked her, how are you feeling? Immediately otherwise she was crying, and immediately that girl replied that I'm feeling better from inside. Even though the fever had, of course, the fever won't go down in 15 minutes, but the girl said, I'm feeling definitely better and your medicine has definitely worked. Please keep on giving me the medicine. So this is quality of life. If you select a correct medicine, you can improve the quality of life in cancer survivors. Just now, it is as important as cancer regression in a scan. Quality of life in elderly population. We have so many elderlies who have so many problems. Just now I had a case. He was not able to pass urine. There was some kind of stricture or whatever. He was an 80-year-old patient, and he improved a lot with homeopathy. Now, when he started improving and he felt that I've improved by 50 or 60%, he stopped taking the medicines from last 2 months. So the problem recurred. So after 2 months, he came today and he requested me to for the medicines again. Why? Because he cannot go for surgery, he cannot go for whatever the injections and whatever things the modern medicine practitioners were advising him. He was very scared. Besides, he did not wanted to go under the knife. For obviously, there are so many cases we hear from anesthesia. There are so many deaths. Today only, there was a 150 kg person who was undergoing this surgery for obesity, and he died on the operation table because of anesthesia. The moment anesthesia was given, that very moment the patient collapsed. So we do not need for elderly population. Most of my patients suffering from renal failure and from liver cirrhosis, they are elderlies. All of them almost are of like 60, 65 or 70 years of age, and they're improving so well. Their quality of life is so better. Even if the reports do not improve, even if I'm not able to help them with the dialysis, even if they are undergoing dialysis twice a week, then too they are taking homeopathic medicines. Why? Because they are able to breathe, the fresh air. They are able to enjoy that. They are able to enjoy their food. They are able to sleep properly. So this is what now counts as per WHO. Then quality of life in mental health disorders. Again, homeopathy has so much to do here. Mental health disorders. Now, all the patients, almost, if they are on antidepressants for a very long time, if they are like more than for 10 years or 15 years, and if you get their fibroscan done, the liver fibroscan, you will find that the liver has definitely shrunken a bit. If not, if they are not in chronic liver disease, they still, their liver, the fibroscan would be above 6. It can be 7, it can be 10, it can be any number. But here is where in all these schizophrenics, OCD patients, depression, anxiety, everything can be handled so well with homeopathy. And even if that problem isn't going, the patient will stick to your medicine. Why? Because the quality of life improves. I have a patient in from Faridabad suffering from renal failure, and he has OCD from a very, very, very long time. And he is like around 50, and he has been taking the medicines from last 20 years. His liver is also affected. His creatinine is around 6 or 7. But the moment he has started taking medicines, he is he is always telling of improvement. Why? Because he is able to interact better with his peers in the office. Otherwise, he was fighting with almost everybody. But now he is on cordial terms with his peers, his associates. He is in a better mood when he is at home. So in homeopathy, there is great, great, great scope for treating all of these diseases and to improve the quality of life. Now, the key components of quality of life are the physical health, as we have already discussed, psychological well-being. Yes, even we have discussed this as well. Social relationships, that I should not be antisocial, I should not be withdrawn. If I'm healthy, I should be able to talk to people. Like in countries abroad, in Canada, my cousin lives there, and she says that if you come across someone while walking on a street, if you come across someone and if you do not smile back, or if you do not respond to greeting, then people are worried, what has happened to the person? Why are they behaving like that? Why are they ill? Why are they behaving in such a manner? So social relationships, our interaction with everything around us is very important. Some people are very good to the humans around us, but they are not, they are very wicked to the animals, to the plants around us. So we keep on, hearing these kind of things, that someone dropped a dog from somewhere, or someone killed a pet mercilessly. So this all comes under quality of life, and this all has to be there. The social relationships with you, with everything around you, is equally important. Environmental factors we have already discussed. Material well-being is also important, not to a very great extent that you become greedy and you start hoarding things like arsenic. No. But there has to be, you cannot be sulfur or arsenic. The sulfur renounces everything. He's not bothered about the kind of dress he is wearing, the kind of smell that is emanating from him. So material well-being is equally important, that the kind of house you are living in, it should be proper, if not lavish. Personal fulfillment, the extent to which an individual feels a sense of purpose, that am I purposeful, am I helping anyone, am I useful to the society? So this is it. Now, in order to be to have quality of life, in order to live successfully, there are lot of skills which a person needs to acquire over the time, over the life, so that their quality of life improves. Now, there are the technical skills, which all of us know, that there are skills which we are good at. There are things we are born with, and then there are things which we acquire later in life, like medical procedures, data analysis, graphic designing. I mean, we can excel in any of these things. So these are the technical skills which we acquire to improve the quality of life, because this is directly or indirectly related to finance, and which has a great role to play in quality of life. Now, soft skills, which means communication. If I was not good in communication, I would not have been presenting this in front of you. Then teamwork is very important. Problem solving, leadership qualities, all these things are taken into account nowadays in all corporate jobs. Then cognitive skills, how am I with problem solving? Like, this is something which was found in COVID period, that there are people who are doing very well, who are placed very well, but they do not have the problem solving skills. So these are life skills that we should be able to tackle day-to-day problems. If we are in crisis, we should be able to manage that crisis. Communication skills, we have already discussed that, which means not just communicating, not just talking, but active listening. This is something very, very important for the doctors, for homeopathic doctors. Why? Because most of my patients, they say that I want to meet you. Why? Because when they come and they sit across, and they are able to tell whatever is going inside them, however they have been feeling, all of that, takes their stress out, and they say that I am 50% better because of what I've told you. I've told you everything, and now I'm feeling already 50% better. So this is communication skill, not just what you are speaking, but how you are listening, how are you making that person comfortable. Social and emotional skills, this we have already discussed a lot. Now, not everyone around us will focus on all of these skills. So there are different stages to develop the skills. The first stage is the survival stage, where we are concerned about roti, kapda, and makan, which means the basic necessities of life. The second stage is the stability stage, when we have achieved the basic necessities and we are looking forward towards the comforts. Then there are three stages: the necessities, the comforts, and the luxuries. So achievement stage is when we reach the stage of procuring luxuries for ourselves. And the fourth stage, the transcendence stage, is when we are able to give what we have to others. So skills are as per these stages. When we are at the survival stage, we need different kind of skills, and similarly, when the stages change, our skills, the need for the skills change. So these are the few important skills which we must acquire in order to improve our quality of life. The first is the communication skill. We have already discussed it. Then the problem solving skills, emotional intelligence. This is something very important. Why? Because in COVID, lot of high ranking officials and highly placed individuals, they committed suicide. Why? Because they were not able to manage the crisis. They were not able to understand what to do when they did not have salary for 2 or 3 or 4 months, or they were shelved, they were removed from their jobs. So emotional intelligence is something which should be the basic, and this is there in the curriculum abroad, in Japan and few other countries, not so much in India, but then these life skills should be there in the curriculum. Resilience and stress management, we have already discussed this, how important is stress management is, because everyone responds differently. Two brothers would respond differently to their mother facing a critical illness, the parents facing a critical illness, there is this Doctorpreneur Academy, which helps the doctors to become entrepreneurs. So a person over there, I had spoken to him. He said that when and there are like 4 or 5 siblings. So he was the one who had great depression. He was MBA from some IIM, but he could not cope up with the loss of his mother. The rest of the children, the siblings, they continued with their life, and his life took a back seat. I mean, he could not concentrate on his job. He had to leave his job, and then for a number of years he was like that. And gradually, after 3 or 4 years, he was able to overcome that depression, and then he started with that business. So stress management is something which is really important nowadays. Now the next is that decision making skills. What should we decide and when a decision should be taken? And especially it is very important for homeopathic doctors, because we have to decide each day when to give that anti-miasmatic medicine, when to give that acute medicine. So decision making skills has to be something that has to be worked upon. Time management on organization. All the successful people of the world, they manage time very, very well. This is something which is common to everybody, and someone who is very lazy, who's always procrastinating, has some kind of definitely has some kind of disorder which needs to be worked on. Interpersonal and social skills, this again we have discussed. Financial literacy, financial knowledge, not just that you are making money, because there was a person from Bihar only who won that who wants to be a millionaire. He had won 5 millions, and after a few months or maybe after a year, it was found out that he is living in tatters. Why? Because he has lost all his money, because he was lacking financial literacy. So even if you are making a small amount of money with financial literacy, you can create assets and you can be successful and take good care of your family and improve your quality of life. So self-care and well-being, again, self-care is very important. Please do not be like the patient of sulfur, who neglects himself, who is neglecting his appearance and all. And when a person comes and sits, this is all of these things have to be taken into account. What kind of dress are they wearing? Is it neat or not? Then digital literacy is something, digital communication is something we all would vouch for it, because it is nowadays, it's so important. So these are the essential clear. One has to have the clear goals. Then active practice, I'm just going through it because I think I have just 10 minutes left. So continuous learning is something which is very essential. Feedback and reflection, persistence. Now, what is WHOQOL? It stands for World Health Organization Quality of Life. It refers to a series of instruments that have been developed by World Health Organization to measure an individual's perception of their own quality of life. Now, this includes the physical health, the psychological health, the environmental health, and the social relationships. This is the definition given by WHO. I'm not going into detail because we have already discussed all of this. Now, what are the benefits of this questionnaire or this method, this instrument? Is comprehensive assessment. Comprehensive assessment means the detailed assessment of a person, which includes the physical, the psychological, the social, the environmental, everything. So this is this questionnaire consists of 30 questions, which probably we'll discuss in the next webinar, because I don't think we have much time left. So you'll come to know that just the 30 questions that the set of 30 questions, it's comprehensive. It includes everything. Then this is standardized measurement. Standardized, why? Because it consists of framework that allows for comparisons across individuals, populations, cultures. So even if a patient is living in a village, they can be assessed using this. If a patient is living in a distant land, distant country, then too they can be this instrument can be used to assess them. So it is a very standardized measurement. Why I'm saying this? Because these people who were behind this QOL, it's been years. We'll just see it took a number of years. Initially there were 100 questions, then there were few more, then there were few less. Now there are 30 questions which encompasses everything. And then the next point is cross-cultural applicability. So this is what I meant earlier, that it is for all the cultures, all the religions, all the regions, all the age group, for everybody. So policy and program evaluation, then patient-centered care, research and evidence-based practice. All of these things we do not need to go into much details. Now, there is this subjective perception. The WHO QOL recognizes that quality of life is subjective. Obviously, I will tell about my quality of life. No one else can decide that. Even if everything is okay around me, I might still feel that I'm not okay, I'm not happy. So the subjective perception is what this takes into account. Then multidimensional approach, we have already discussed it, that it takes into account of social, environmental factors, everything, the physical, the psychological, everything. All this is sort of repetition. Cultural sensitivity, we all know, we have already discussed this. Individualized perspective. Now, the set of 30 questions, they give the individualized perspective. Why? It emphasizes the importance of considering individuals' unique circumstances. My circumstances are different from the others. So how do I feel about my life, about the quality of my life? Positive functioning and well-being. This positive approach to life is very important, and now it is an essential part of health. Contextual factors, the WHO acknowledges that quality of life is influenced by contextual factors as well, including socioeconomic conditions, cultural norms, and environmental factors. So you have to survive in your own environment. You cannot run away just to improve your quality of life. Now, this is the history of WHO QOL. And what had happened actually in 1980s, India had become the diabetes capital of the world, and the whole of the world was surprised. WHO was surprised. Why is it that so many Indians are having diabetes? So then is how they were assessing the reasons for that, and then is when this QOL, or the quality of life term, came up. And in 1990s, the WHO recognized the need for a standardized and comprehensive measure of quality of life. So I won't go in all these details. If anyone of you is working on it and they want this PPT or any information about this, since I have a certificate, I took a training with them, so I can provide all of this. They can like WhatsApp me, and I can mail them or WhatsApp them. So these are the scientists who were there to coin this present instrument. As I already told, initially there were 100 questions, more than 100 questions, then they were cut down to fewer questions. But ultimately, just now the instrument has 30 questions. And our Indian scientist, Dr. Shekhar Saxena, is also there. He also has worked over a number of years to come up with the questionnaire that we have just now. So parameters to validate: it's reliable, it's very reliable, it is valid all over the world because consistent scores and internal consistency, interrelatability, all of that leads to reliability. Then second, validity. Again, I would say that will remain valid throughout the world. The grading or the numbers you give, that would be valid. The quality of life, it would be valid throughout the world. Content validity, then criterion validity, construct validity, convergent, and all these, I don't think we need all of these details. Then sensitivity and specificity. The questions, they have been designed in such a way that they are very sensitive. I mean, whatever is going inside you about your health, about your surroundings, the questionnaire will definitely catch that. So factor structure, exploring the underlying factor structure of the tool through techniques such as factor analysis can provide evidence. Again, we do not need it, this so much responsiveness. Now, is it a standard assessment tool? Of course, it is a standard assessment tool, because if you are conducting a study, even if you have like 20 or 40 or 50 patients of a disease, of a particular disease, and you use this WHOQOL for the assessment of the patients, then too that will work. So I mean, it is now very easy for each and every homeopathic doctor to publish their results using this questionnaire. I mean, if you cannot get the patients to conduct tests, pathological tests, or the radiological tests every now and then, still you can like have 6 months follow-up using this questionnaire, and you can publish your study. So administration, there is election of participants. You have to be very specific for each and every research study. We have to take into account certain factors, and the same is with this instrument. And you have to target a specific age group and a specific health condition, or there can be a general population sample as well. Then training of administrators, the whoever is the administrator, whoever is conducting the test, they should be trained very well, so that they can explain the questions to the participants well. So because if it is given in English, then you have to tell them in their dialect, the patient or the person who is undergoing this. Then questionnaire distribution, it can be in various forms. It can be a digital form, it can be filled on paper using a pencil. Then instructions and consent. Consent is very important. You cannot publish anything, you cannot conduct any study without the written consent of the patient. So this is something very important, and this is important for this instrument as well. Self-completion or interview, if it is a person is writing that themselves, or it is in the form of an interview. Scoring and data analysis, this is something which is very easy, like when you conduct 2 or 3 or 4 few instruments, few tests, and then you will be able to understand how to give them scores and how to analyze the data. Data interpretation and reporting, just like any other study. So I think we should not This is the sample consent form, but I won't go into the detail. Why? Because we have just few minutes left. I was told 45 minutes now. So all of these things can be taken up in the next maybe webinar. So I'll stop sharing this slide for now.
Yes, Doctor, it's a really a very good session. You really uh, uh, brought our attention to all those things which are very, very relevant as far as a doctor is concerned. What are the things WHO proposes, and what are the questionnaire things in the questionnaire, and how one can utilize these questions for the betterment of your own treatment as well as for the betterment of the people at large. Anyway, congratulations for such a wonderful session. Hope that we can have some more presentation of the same in the coming days, as you told earlier in this session. And those who want to participate can come out, and you can have a chat with Dr. LUBNA KAMAL. And those who want to add anything more to this session also can add your observations and your suggestions and anything that can be a good thing for the person in particular, doctors in particular, as well as the public in general.
So
Yes.
any questions, any comments, anything to discuss or ask? Please go ahead. This is relatively a new topic for homeopathic doctors, but very useful, believe me.
I invite Sridharakulam sir. Sir, what's your opinion on all those things? Have you gone through the observations made by?
Someone has asked for the questionnaire. That is available with the WHO website. But the more important thing is first to understand a lot of things about the questionnaire. Actually, then you will be able to frame the questions accordingly.
So, please say the questionnaire. I say already.
Okay.
Yes.
LUBNA KAMAL, doctor, it is very interesting and very good, excellent session. Please come with another that it is very useful in questionnaire like these things, that in especially psychology and such type of the analysis of such type of the questionnaire is utilizing, and for the some type of the research also, this type of the questionnaire are you utilizing. So it is very useful. So thank you very much. Come again with another topic. It is very, very good. Thank you very much. Come again with another subject or the continuation of the subject also.
Continuation, yes.
Most welcome. Very excellent. Very good for, especially for researchers. It is very good.
Thank you.
Thank you very much.
One important thing I would like to mention over here, sometimes the patient are very sly. They do not tell you easily that they are better by your treatment. So what you can do with these kind of patients, or someone who has been drugged for a very long time. So what you can do for these kind of patients, that you take this questionnaire once they come for first follow-up, or maybe when they start with the treatment, and then you again assess them after 3 or 4 months, and you can just prove it to them that you are better using this questionnaire.
Oh, okay, very good. Excellent. Yes.
Yes, as you told earlier that this palliation, that is also very important in case of these typically aged patients who are bedridden, and there was no one to take care in those conditions. Homeopathy can assist in a beautiful way. Yesterday itself, I have seen a patient who was bedridden, and he was in drowsiness, and was just like in a sleepy mode, and not answering, not taking any food or anything. But in those conditions, after they want to have an inspection from me only. But after noting the signs and symptoms, I just prescribed opium, one of them, and it really works in a beautiful way. And he is quite normal now. So these kind of things homeopathy can do in those kind of, because the patient was taking a lot of medicines from the other side, and from the from a neurologist as well as from a psychiatrist. That much of conditions, that's maybe the reason why. But he was admitted in a hospital and was brought to home after there was not much recovery. They told him that, told the bystanders to take him home, and it's better to take care of the in-laws. So in those conditions, homeopathy can do wonders. As there is no objection from anywhere, because all of us are qualified doctors, registered medical practitioners. What's your opinion on that, Dr. Lubna?
Pardon?
What's your opinion on that? Is there any obstacle that prevent you from doing all those things, even without the other facilities?
Mhm. See, sir, there are like a number of scoring systems for different kinds of diseases. So most of the homeopathic doctors, they are not aware, and that is why like we are not able to publish our results. If we use like different scoring systems for migraines, there are scoring systems. For vitiligo, there is VASI, which is a scoring system. So if we are not aware of all of those, even if we are not aware of all of those things, we can at least make use of this single questionnaire and we can publish our results.
Yes.
Even research protocols, all these things are mandatory. In research protocols, all these things are mandatory. They don't agree that even to the CCRH or to the ICMR will not agree for that. That there is a protocol. All it contains
There
all these.
are actually there are different protocols for different diseases. There are, that is what I said, that there are different scoring systems for different diseases. You cannot apply that scoring system to for a patient of terminal cancer. You know, for this, for that, you can use this. And what I'm trying to say is that quality of life is something each and every homeopathic doctors can improve, no matter what they are treating. This is something, even if I'm not able to give relief to a patient of arthritis, I can still improve their quality of life. Do you agree or not?
Yes, yes, definitely.
Especially even the so-called incurable case, especially cancer
Yes.
and such cases.
All incurable kind of
Radiation,
conditions.
how
See,
much?
when a chronic case comes to us, they have already been drugged so much. They have already been to a lot and lot of hospitals, to the biggest of the hospitals. That this is what I see in my practice each day. That a renal failure patient who comes to me has been to the top nephrologists, the top hospitals, AIMS, PGI, etc., etc. So I do not promise them that I will reduce the creatinine or I will reduce your dialysis, but I definitely tell them that you will be better when you come next. And usually I give them medicines for 15 days, and they definitely report this, that they are feeling better. Their appetite has improved. They have the desire to live. They are not depressed. They are no longer depressed about their disease, which is something very huge as per WHO now.
What about your opinion about the counseling and the psychological treatment, sum up to the
It is definitely very, very important. But see, this is something scientific. This WHOQOL is something which is scientific, which through which you can prove something. Counseling is important. Even if the patient is better by counseling, how can you prove it? How can you publish the result? How can you just come up with a study? So this is something which is very scientific, and the homeopathic doctors should make use of this to publish. We lack so much in publications. I mean, as compared to a modern medicine medical college and allopathic medical college, you compare to a homeopathic medical college, we lack so much in publications. We are doing good work. Each and every homeopathic doctor over here, they are all are doing wonderful work, but we are not publishing our results.
But there are very few like that of Girish Gupta and all this. In your Lucknow itself, there is a one Dr. Girish Gupta. He is doing a wonderful work. There are few they are doing really.
Yes, I have interned. I'm in Lucknow only, and I have interned with Dr. Girish Gupta, and this was the reason why I went to him, because he was publishing so much. He was conducting so many research work. So that was the reason why I went to him, and I had worked with him as a trainee for a year. Why? To just understand the documentation, the research processes, whatever he was doing. So I wish all the homeopathic doctors, if each and every homeopathic doctor publishes at least one paper or one case even a year, homeopathy will be very different from now what is it it is now today.
Yes, exactly. This is what we are supposed to do, deliver. That's why the International Forum for Promoting Homeopathy has formed. And that's the reason why we are uploading every video nowadays. We will be uploading the video of the session tomorrow itself by evening, so that those who can watch again and again, and those who can, you can share to your public as well as to the persons who are interested in homeopathy, and somehow some people search us in YouTube, then they may get some good knowledge about homeopathy. And this is what International Forum for Promoting Homeopathy. That's why our group has comprises of homeopathic lovers, students, and doctors. It is not only a organization of doctors, but it comprises with a lot of homeopathic lovers. Because the homeopathic lovers who started the Zoom itself, our forum itself was formed by a group of homeopathy lovers and not the doctors. The doctors joined with them, and then we worked together, and that's how we reached this much of 1,333 days. So definitely we will have to give an opportunity to the public to watch these things, and what are the things happening with homeopathy in and around the world, and how it works. And those people who are interested in knowing all, they can definitely watch our YouTube programs, and can understand that even without paying a single penny for that. That's the beauty. Anyway, we are lucky to have such a beautiful presentation from Dr. LUBNA Kamal. She has presented various papers, particularly from nephrology in the earlier sessions, but today it was really an entirely different session, and that is a motivational session also. Definitely doctors can come up with successful cases, and can publish accordingly as well as per the protocol proposed by the question and answer model by these WHO protocol. Now I invite Dr. Boblin to say, from Malaysia, to say vote of thanks to Dr. LUBNA Kamal. And tomorrow we will have another session from Dr. Abida Salim. She has completed her BHMS and then diploma in counseling psychology, and she is a senior consultant at Dr. Basil Homeopathy Clinic, Qatar, and is the daughter of our homeopathy lover, Dr. Sri Mr. Salam, Abdul Salam from Qatar. And the subject of discussion will be importance of early intervention of mental health issues. So that will be another big session coming for tomorrow. Now I invite Dr. Boblin, are you there? Please unmute yourself. If you find any difficulty, okay. Dr. Mas, you can say what are thanks. Dr. Mas, please unmute. Yes. You are also not able to unmute. So I invite Dr. Rampari sir to say what are thanks.
Thank you, Dr. Dhaneji. Congratulations, Dr. LUBNA Kamal. Very nice presentation. Excellent session. Beautiful describe quality of life according to law, WHO. Excellent session. Very, very thanks, LUBNA Kamal. Thank you. Behalf of IFPH, very, very thanks. Again, presentation, IFPH. Thank you.
Thank Doctor, you want to say anything? Dr. LUBNA Kamal, doctor, you want to say anything? Please unmute. Please unmute.
I just wanted to thank everyone to be here, and in the next webinar, we'll come up with the rest, whatever is left. Thank you so much.
Yes, thank you, Dr. LUBNA Kamal, and those who participated in the session. With that, we come to the end of the day 1333. Thank you all. Good night. See you all tomorrow at the same time.